10. Hidden vitamin deficiency symptoms you should never ignore. Meet Grace. She's 67, walks her dog every morning, and tries to eat healthy most of the time. On the outside, she seems perfectly fine, but lately, she's been feeling off. She's more tired than usual, her legs cramp at night, her skin's become dry. And worst of all, her mood swings are starting to worry her children. But doctors say everything looks normal. Sounds familiar? Have you ever had sudden cramps in your calves, dry lips that just won't heal, or felt unusually anxious or blue without any clear reason? If yes, you might be missing something essential. No, we're not talking about rare diseases. We're talking about common vitamin deficiencies, the kind that sneak up quietly and can cause serious health issues if left untreated. And for seniors over 60, these silent deficiencies become more dangerous with age, potentially leading to fatigue, weak bones, memory loss, and even depression or heart issues. In today's video, we'll uncover 10 hidden signs that your body is lacking the vitamins it needs to stay strong and healthy, signs your doctor might have overlooked. So ask yourself this: are you already experiencing one of these symptoms without even realizing it? 1. Cracks at the corners of your mouth, a hidden sign of vitamin B2 or B12 deficiency. Have you ever smiled and felt a sharp sting at the corner of your lips? Or noticed little cracks that just won't go away, no matter how much lip balm you use? Well, that could be more than just dry skin. It's often an early, silent signal that your body is lacking vitamin B2, riboflavin, or vitamin B12, two crucial nutrients that keep your skin, nerves, and blood cells healthy. Vitamin B2 helps repair the soft tissues around your mouth, and B12 supports nerve function and red blood cell production. When you're low on these, the delicate skin around your mouth becomes vulnerable, and even tiny movements, like yawning or smiling, can cause painful cracks. Many seniors develop this without knowing why. And one big reason? As we age, our body absorbs these vitamins less efficiently, especially if you're taking medications like antacids or have a diet low in animal-based foods. According to a study published in the American Journal of Clinical Nutrition, vitamin B12 deficiency affects up to 20% of adults over 60, and yet it's often missed during routine checkups. So, what can you do? Add more eggs, dairy, lean meats, or consider a B-complex supplement, but always check with your doctor before starting anything new. Have you ever noticed cracks or soreness in the corners of your mouth? Comment yes or no below. You're not alone, and it might just help someone else realize what's happening to them too. Now, that was just the beginning. The next sign is even more surprising. It might be keeping you up at night without you realizing it. Let's talk about leg cramps and what they're really telling you next. 2. Nighttime leg cramps, a common sign of magnesium, calcium, or vitamin D deficiency. Have you ever been jolted awake by a sharp, painful cramp in your calf, out of nowhere? It can feel like your leg has a mind of its own, tightening up and refusing to relax. This isn't just about getting older or sleeping in the wrong position. Very often, this is your body's way of saying, I'm missing essential minerals. Magnesium, calcium, and vitamin D all play a key role in how your nerves communicate with your muscles. Without them, the signals get scrambled, and muscles can spasm uncontrollably, especially during rest. Seniors are particularly at risk because our ability to absorb these nutrients decreases with age. Certain medications, especially diuretics, water pills, can also flush these minerals out of the body more quickly than we can replace them. A study in the journal Nutrients found that magnesium deficiency is significantly underdiagnosed, yet linked to sleep disorders, muscle cramps, and even heart rhythm issues. But here's the good news: it's fixable. Leafy greens like spinach, fatty fish like sardines, and a little morning sunshine can go a long way. Sometimes, a gentle supplement helps, but always consult your doctor first. Have you ever experienced a sudden leg cramp at night? Comment yes or no below. You'll be surprised how many others go through the same thing. Now, if you thought cramps were annoying, Wait until you hear how a single missing vitamin could be silently causing your hair to thin and your nails to weaken. Let's dive into that next. 3. Thinning hair and brittle nails. Your body might be craving biotin, vitamin B7. Have you noticed more hair in your brush lately? Or that your nails break more easily than they used to? It might not just be age. It could be a sign that your body is running low on something very important, biotin, also known as vitamin B7. Biotin plays a key role in the production of keratin, the protein that makes up your hair, skin, and nails. Without enough of it, these parts of your body become weaker, thinner, and more fragile over time. I've seen many older adults struggle with this without realizing the root cause. And interestingly, two things can significantly reduce your body's biotin levels: long-term use of antibiotics and regularly eating raw egg whites, which contain a protein that binds to biotin and blocks its absorption. A study from the Journal of Dermatology found that patients with brittle nails and hair loss often showed significant improvement after just 90 days of biotin supplementation. So what can you do? Start with food. Fatty fish like salmon, almonds, sweet potatoes, and cooked eggs are all great sources of biotin. And if you're considering a supplement, always consult your doctor first. Have you experienced thinning hair or weak nails recently? Let us know with a quick yes or no in the comments. Your answer could help someone else connect the dots too. Now, while hair and nails are external signs, what if I told you your skin could also be silently signaling a deeper vitamin deficiency? Let's explore that next. 4. Dry, flaky skin. Your body may be lacking vitamin A or omega-3. Have you noticed your skin becoming rough, flaky, or itchy lately, even when you use moisturizers? This isn't just about weather or aging. It could be your skin's gentle way of saying, "I'm not getting what I need from inside." Vitamin A plays a critical role in skin renewal, helping your skin shed old cells and generate healthy new ones. Meanwhile, omega-3 fatty acids keep your skin naturally hydrated by strengthening its outer barrier. When your body doesn't get enough of these nutrients, the skin can dry out, crack, or even feel itchy and inflamed. And here's the thing. Seniors are more prone to this because many older adults eat less fatty fish or healthy oils, either due to diet restrictions or simply changing taste. A study published in Clinical Interventions in Aging found that low intake of vitamin A and omega-3s was directly linked to chronic dry skin and poor skin healing in older adults. So what can you do? Try adding cooked carrots, chicken liver, sardines, flaxseed oil, or even a fish oil supplement to your daily meals. Not only does it help your skin, but it supports your heart and brain too. Have you struggled with dry or itchy skin lately, especially on your arms or legs? Let us know in the comments and share what you've tried to fix it. Now, if your skin is trying to send a message, just wait until you see what your nails might be revealing. Because up next, we're talking about a tiny white spot that could mean something much bigger. 5. White spots on your nails. A silent signal of zinc deficiency. Have you ever noticed tiny white spots on your nails and thought, maybe I just bumped into something? Well, you're not alone. Many people assume it's from minor trauma, but in reality, it could be your body waving a quiet red flag. Zinc deficiency. Zinc is a powerful trace mineral that supports protein synthesis, immune function, and cell repair. Your nails grow from cells that divide rapidly, and without enough zinc, this process slows down, weakens, and can leave behind tiny white marks. This is especially common in older adults, whose bodies may not absorb zinc as efficiently. Diet plays a big role too. If you're not eating enough pumpkin seeds, red meat, or oats, you might be missing this vital mineral. According to research in the Journal of Nutrition, even mild zinc deficiency can impair wound healing, increase infection risk, and affect nail and skin health, especially in seniors. So what can you do? Start simple. Try adding a handful of pumpkin seeds to your breakfast. Enjoy lean beef once or twice a week, or make oatmeal a regular part of your diet. These small steps can make a big difference. Have you ever spotted those little white marks on your nails? If so, comment yes or no below. Your experience might help others realize it's something worth paying attention to. And now, let's move from your nails to something even more disruptive, that overwhelming fatigue that never seems to go away, no matter how much rest you get. Let's uncover what might really be behind it in the next section. 6. Constant fatigue. Could it be iron or B12 deficiency? Have you ever felt completely drained, even after a full night's sleep? Not just tired, but the kind of fatigue that makes getting out of bed feel like climbing a mountain? If so, you're not alone. Many people, especially older adults, brush it off as aging or even laziness. But in truth, it may be your body telling you, "I'm not making enough red blood cells." Both iron and vitamin B12 are essential for creating hemoglobin, the protein in your blood that carries oxygen to every cell. When levels drop, your body struggles to get the oxygen it needs, leading to constant exhaustion, even after rest. This kind of deficiency is especially common in older women and vegetarians, who may not be getting enough iron from their diets or absorbing B12 efficiently. According to the National Institutes of Health, up to 20% of people over age 60 have low B12 levels, and it's one of the most underdiagnosed causes of fatigue in seniors. So, what can you do? Get a simple blood test. It's the best way to find out if you're low. Then, with your doctor's advice, you might need to add iron-rich foods like lean red meat, spinach, lentils, or take a B12 supplement. Have you felt unusually tired even when you've been sleeping well? Let us know below with a quick yes or no. Your answer might help someone else realize what they've been missing. Now, while tiredness can weigh you down, your emotions might also be trying to tell you something, especially if sadness or anxiety keeps creeping in without warning. Let's explore what that could mean next. 7. Unexplained sadness or irritability. Your brain may be missing vitamin D or B6. Have you ever felt low for no clear reason? Maybe a little more irritable than usual, or just not yourself lately. Sometimes we chalk it up to stress, hormones, or just one of those days. But what if your brain is actually missing the nutrients it needs to feel balanced? Both vitamin D and vitamin B6 play a critical role in the production of serotonin and dopamine, the feel-good chemicals that help regulate mood, motivation, and calmness. When you're low on these vitamins, your brain's ability to manage emotions becomes disrupted. This is particularly common in older adults who spend little time outdoors, especially during colder months or in nursing homes. The problem is, we often don't connect low mood with a nutrient issue, and instead, we blame ourselves or our circumstances. Research in the journal Nutritional Neuroscience shows that vitamin D deficiency is linked to higher rates of depression, especially in seniors. And B6? Without it, your brain struggles to create serotonin efficiently. So what can help? Simple steps. Try spending 10 to 15 minutes a day in sunlight. Include salmon, eggs, and bananas in your diet. Or ask your doctor about a safe multivitamin. Have you noticed changes in your mood or irritability without knowing why? Share yes or no in the comments, because chances are someone else is feeling the same way and needs to know this. And speaking of the brain, there's another deficiency that could be affecting something even more essential: your night vision. Let's talk about that next. 8. Trouble seeing in the dark. Your eyes may be craving vitamin A. Have you found it harder to see when the lights are low? Maybe driving at dusk feels more stressful, or walking into a dark room takes longer for your eyes to adjust. This isn't just a part of getting older. It could be your eyes gently warning you, "I need more vitamin A." Vitamin A plays a key role in the production of rhodopsin, a pigment in your retina that helps you see in low-light conditions. When your body doesn't get enough of it, night vision becomes blurry or slow, and your eyes struggle to adapt to darkness. This deficiency is surprisingly common among older adults, especially those who don't eat enough animal organs, leafy greens, or orange-colored vegetables like carrots and sweet potatoes. According to the World Health Organization, vitamin A deficiency is one of the leading causes of preventable blindness, and early symptoms often show up as night vision problems. If left untreated, it can also lead to dry eyes, corneal damage, or even permanent vision loss. So what can you do? You can start by adding cooked carrots, pumpkin, or liver to your diet. These foods are rich in beta-carotene, which your body converts into vitamin A. Have you noticed changes in your night vision or struggled to see clearly at dusk? Comment yes or no. It may help others realize they're not imagining it. Now, while your eyes may show early signs of deficiency, your hands and feet might be trying to tell you something too, especially if you've felt tingling, numbness, or pins and needles more often lately. Let's talk about that next. 9. Tingling or numbness in your hands and feet, a signal of B vitamin deficiency. Have you ever felt pins and needles in your hands or feet, even when you haven't been sitting or lying on them for too long? That strange tingling sensation, or even numbness, might seem harmless at first, but it could be something your nerves are trying to tell you. Your body depends on vitamin B1, thiamine, B6, and B12 to keep your nerves healthy and functioning properly. These vitamins help protect the outer coating of nerves and support the signals that travel between your brain and body. When you're low on these nutrients, nerves can become irritated or damaged, leading to that tingling feeling, loss of sensation, or even burning pain. This is especially common in people with diabetes or those who consume alcohol frequently, as both conditions interfere with B vitamin absorption. According to research in the Journal of Neurology, prolonged deficiency in these B vitamins can cause permanent peripheral nerve damage if left untreated. So what can you do? Include more whole grains, chicken, eggs, and dairy products in your meals. If symptoms persist, speak with your doctor about getting your B vitamin levels tested and possibly starting a supplement. Have you ever experienced numbness or tingling in your hands or feet for no clear reason? Drop a yes or no in the comments. You may help someone else recognize this often overlooked symptom. And now, let's talk about something most people never expect from a vitamin deficiency. When your tongue starts sending distress signals that something deeper is missing. You won't want to miss the final sign. 10. A sore, smooth tongue. Your mouth might be missing. Vitamin B3, niacin. 10. Vim lui hoặc lui trun. Katela dohio tu vitamin B3, niacin. Have you ever looked in the mirror and noticed your tongue looks red, shiny, or oddly smooth? And maybe it even feels sore or sensitive when you eat? It might seem like something minor or temporary, but it could be a sign your body is running low on niacin, also known as vitamin B3. Niacin plays a key role in tissue repair and maintaining the health of soft tissues, including your tongue and mouth. When you don't get enough, the surface of your tongue can become inflamed, lose its texture, and feel tender or even painful. This deficiency can sneak up gradually, especially in older adults with limited diets, digestive issues, or those who drink alcohol frequently. According to a study in the Journal of Clinical Nutrition, long-term niacin deficiency can lead to glossitis, inflammation of the tongue, mouth sores, and even loss of taste if left uncorrected. The good news? It's easy to improve with food. Try adding more peanuts, turkey, tuna, or whole grain cereals to your daily routine. These are all rich in niacin and gentle on digestion. Have you ever noticed changes in your tongue, like soreness or a smoother surface? Comment yes or no below. Your answer might help someone else pay closer attention to this subtle but important signal. Now that we've walked through all 10 hidden signs your body might be missing key vitamins, let's take a moment to reflect on what they mean and what small changes could make a big difference. Because your health doesn't whisper for no reason, it speaks. And today, you've learned how to listen. Sometimes the body whispers before it screams. Little things like fatigue, cracked lips, hair loss, or tingling hands, they might not seem like much, but they could be early SOS signals from within, warning you that something essential is missing. As we age, our ability to absorb nutrients naturally decreases. That means even a balanced diet may not always be enough, especially for adults over 60. The good news? You don't have to feel this way. Small changes, like eating the right foods, getting sunlight, and staying aware of subtle signs, can make a world of difference in how you feel, move, and live each day. Our suggestion is simple. Don't guess. Ask your doctor for a simple blood test. Start with whole foods first. Colorful vegetables, lean proteins, healthy fats, and only take supplements when truly needed. Have you experienced any of these 10 symptoms yourself, or noticed them in a parent, spouse, or friend? Share your experience in the comments below. Your story could help someone recognize what their body has been trying to say. And if you found this video helpful, please consider sharing it with a loved one over 60. It might just help them avoid something serious, or even save their life. Someone you love might have these symptoms without knowing. Send this video to them, just in case. If you found this video helpful, please remember to hit the like button. It truly helps us bring you more content that matters. Drop a comment below and tell us which symptom surprised you most. What topic would you like us to cover next? We love hearing from you, and your ideas help shape our next videos. And of course, don't forget to subscribe and turn on the notification bell so you never miss our latest senior health tips. Stay informed, stay healthy, and from our family to yours, we'll see you in the next video.